My name's Eric Bonno. I'm a general cardiologist with Carolina Cardiology Consultants. I chose cardiology because several of my uncles and aunts are internal medicine physicians, and one of them is a cardiologist. And when I was in residency, he gave me an EKG book, and I read it cover to cover and realized I was pretty good at it, and just liked the clinical syndromes that I was seeing when I was on the cardiology services as a resident, and decided to make a career of it. It's also very important because, as you may or may not know, cardiovascular disease is extremely prevalent in our society. As our populations are getting older and civilization has advanced, people are dying less of communicable diseases, infectious diseases, and they're living old enough to be dying of degenerative diseases, of which atherosclerotic disease and other cardiovascular disease is rife. And so it's certainly something that you can have a tremendous impact. On a more personal level, I enjoy non-invasive imaging. I enjoy reading echoes, reading EKGs, looking at MRIs and CTs and vascular ultrasounds, and so I just personally like doing it. My care philosophy is deeply rooted in the things that my mother taught me when I was very young. My family comes from war-torn Vietnam. They were refugees, and so my family was blessed enough to be able to escape. So from a young age, I was taught that we were blessed, and that equated into being socially responsible. And so I try to be very socially responsible to my patients by looking out for them, by being their best advocate. With 14 years of education, there's certainly things that I know that they may not have any understanding of. And so it's being a steward of their well-being, using the knowledge that I've been blessed enough to have gained in the many years. So when I'm not working, I like to explore the city. I have a dog, and I like to take him out walking around. He's very rambunctious, so I need to get his energy out somehow. I'm also a big cinemaphile. I like watching lots of movies, especially old horror movies, old Japanese movies. I also like to travel, and so when I have time, when I'm not studying for something cardiology related, I like to teach myself languages and then go travel a little bit.